Welcome. My name is Washonda Jones, and I'm an instructor here at UMA in the MBC program. Today we're going to look at word structure in ME1160 for the male genitalia or male reproductive system. The male I'm going to go over. You see here there are several combining forms for the male reproductive system. You have listed for the male the penis and testicles. You see there are several terms that refer to the penis as peni and fili. For the testicles, you have auric or auric and testi and testo. It also lists the combining forms for female. You have ovaries, oophra, and ovary. For your fallopian tubes, the term or combining form for that is salpingo. And then the uterus, terms referring to the uterus are histo, metro, metri, utero. And for the vagina, you have vagine, colpo, and then for the placenta, we have placento. When we're referring to the reproductive system of both sexes, we usually refer to that for the genitalia, organs of reproduction and their associated structures. The external organs or reproductive organs are located outside of the body, and internal genitalia, the reproductive organs, are located within the body. For the male, the primary function of the male reproductive system is to produce sperm and deliver them into the female body for union with ovum to create new life. Structures of the reproductive system, you have external male genitalia, as we mentioned before, and internal male genitalia. For external, you have your penis and scrotum, which contains 2 testicles. Then for internal male genitalia, this includes the remaining structures of the reproductive system. This slide of the structures of the male reproductive system lists or shows the external and internal male reproductive system. And this slide also lists structures of the male reproductive system. Let's first take a look at the scrotum and testicles. Your scrotum for the male is a sac-like structure that surrounds and protects and supports the testicles. It's suspended from the pubic arch behind the penis and lies between the thighs. The testicles, these are 2 egg-shaped glands that produce sperm, develop within the abdomen of the male fetus and normally descend into the scrotum before or soon after birth. Semi and various tubules are the site of sperm formation, and the epididymis is a coiled tube at the upper part of each testicle and descends the length of the testicle, then moves upward to merge into the vas deferens. Also within the testicles is the spermatic cord. It attaches to each testicle, extends upward from the epididymis, and contains your vas deferens, plus arteries, veins, nerves, and lymphatic vessels for each testicle. Semen and semen formation. Semen is the whitish fluid containing sperm or male gametes. It's ejaculated through the urethra at the peak of male sexual excitement. Spermatogenesis is the process of sperm formation. You see the combining forms here of spermato for sperm and genesis is formation. The ideal temperature for sperm formation is 93.2 degrees Fahrenheit. Sperm moves from the semi in various tubules of the testicles into the epididymis, where they become motile and are stored. From the epididymis, sperm travels to the vas deferens, where seminal vesicles and prostate glands add secretions to form semen. Let's next look at your penis. This is a male sex organ. It transports sperm into the female vagina. There are 3 columns of erectile tissue. High pressure leads to filling of erectile tissues with blood during sexual stimulation. The glans penis is the sensitive region at the tip of the penis. There's also foreskin. This is retractable, double-layered fold of skin and mucous membrane. It covers and protects the glans penis, also known as the prepuce. Let's next look at the vas deferens, seminal vesicles, and ejaculatory duct. The vas deferens is a long, narrow continuation of each epididymis and leads upward and joins the urethra. Your seminal vesicles are located at the base of the urinary bladder and opens into the vas deferens. It secretes yellow substances to nourish sperm cells. The ejaculatory duct begins at the vas deferens. It passes through your prostate gland, empties into the urethra, and has a reflux action that pushes semen into the urethra and out of the body via the penis. Let's next look at your prostate gland, which lies underneath the bladder. It surrounds the end of the urethra where vas deferens enters the urethra. It also secretes thick alkaline fluid into semen, aiding motility of sperm during ejaculation. Next, you have your bulbourethral glands. These are located just below the prostate gland. It opens into the urethra. It secretes a pre-ejaculatory fluid, helping flush any residual urine or foreign material into the urethra. Fluid may contain sperm and may cause pregnancy if ejaculation does not occur. Let's next look at your urethra, which passes through the penis to the outside of the body. Part of both the reproductive and the urinary systems in males. A urologist specializes in diagnosing and treating diseases and disorders of the genitourinary system of males and urinary systems of females. Some common pathologies that you may see associated with the male reproductive system. Let's look at the penis. A condition known as blinitis is inflammation of the glans penis, may be due to poor hygiene if not circumcised. And you see there, bilin equals glans penis. Also, phimosis is a condition, narrowing of the foreskin preventing retraction to expose the glans penis. May be present at birth or become apparent during childhood. Another condition associated with the penis is erectile dysfunction. This is the inability of male to achieve or maintain a penile erection. There's also a condition called Peyronie's disease. This is when the penis is bent or curved during erection, leading to sexual dysfunction. Priapsism is a painful erection lasting 4 hours or more, not accompanied by sexual excitement, and does not diminish after sexual stimulation ends. There's also a condition called premature ejaculation. This is early climax, usually before or shortly after penetrating the female's vagina. Next, let's look at some conditions associated with the testicles and the related structures. Andropause is decrease of testosterone. Usually begins when a male is in his late 40s. Andro, you see there, means male or masculine, and of course pause means stopping. So andropause. Cryptorchidism is undescended testicles. This is a developmental defect. You see here that crypt means hidden and orc means testicles. A condition known as anachronism is a congenital absence of one or both testicles. And epididymitis is inflammation of the epididymis. Hydrocele is fluid-filled sac in the scrotum along the spermatic cord leading from the testicles. You see here, hydro means water, and cele is hernia or swelling. This diagram here shows you pictures of certain conditions. In A, you see there's epididymitis. The B diagram shows you testitis. And C shows you a condition known as varicose. Spermatocele is the milky fluid-filled cyst in the epididymis. And testicular cancer, that's cancer that begins in the testicles. This is the most common cancer in American males between the ages of 15 and 34. Testicular torsion is pain in the scrotum caused by twisting of the vas deferens and blood vessels leading into the testicle. Testitis, which we saw on the previous slide, is inflammation of one or both testicles. And varicose, which we saw on the previous slide as well, is a knot of varicose veins in one side of the scrotum. We see here varicose stands for or equals varicose veins. A normal range of sperm count is between 20 to 120 million or more per milliliter of semen. Azoospermia is absent of sperm in semen. We see here that zoo means life. Oligospermia is a sperm count below 20 million per milliliter. Hematospermia is presence of blood in seminal fluid and can be caused by infection of seminal vesicles, prostatitis, uritis, or the urethral structures. Sperm count is known as the testing of freshly ejaculated semen to determine volume plus number, shape, size, and motility of sperm. Testicular self-examination Is self-examination beneficial in early detection of testicular cancer? Some treatment procedures of male reproductive system. General treatment procedures or circumcision is just a surgical removal of the foreskin of the penis. Orchidectomy or orchectomy is the surgical removal of one or both testicles. Orchopexy is the repair of undescended testicles. Varoselectomy is the removal of portion of the enlarged vein to relieve varicocele. Castration is the surgical removal or destruction of both testicles. Vasectomy is the male sterilization procedure by surgical removal of a small portion of the vas deferens. This is done to prevent sperm from entering the ejaculate and does not change the volume of semen. Vasovasotomy is an attempt to restore fertility of a vasectomized male. Thank you for listening. This concludes our discussion on the word parts for the male reproductive system.